Hi, guys. Welcome back for our daily practice questions. As always, I like to get into my disclaimer and introduction before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, review videos, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to get into my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AAMP exam. Now, any of the videos that you may see, if I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a patient presents to the office with complaints of fatigue, muscle, and joint pain. She states that she has had increased weight loss and she stays nauseated. Upon examination, it is noted that the patient's blood glucose level is low. Based on these findings, what is the best differential diagnosis? Is it A, hypothyroidism, B, hyperthyroidism, C, Addison's disease, or D, Cushing's disease? Take a moment and tell me what you got in the comments, you guys. All right, you guys. So the stem of the question states, based on these findings, what is the best differential diagnosis? So, I always say if they're asking for a diagnosis, you need to run it back and look at the assessment findings. And if it's asking for a differential, it lets you know that we have not confirmed the diagnosis, but based off of what you see, what are the things that you should start to consider as potential differentials? So this patient came in, they're complaining of fatigue, they have muscle and joint pain, she has weight loss, nausea, and her glucose is low. Now, the fatigue, weight loss, things of that nature can put you into the mind frame of thyroidism, right? With weight loss, it could be hyperthyroidism. The fatigue could be any level of thyroidism, more commonly with hypothyroidism. But you can see that you can start to potentially eliminate the two because of how those differ. You also don't typically see nausea with thyroidism. Now, when we look at the nausea and also the hypoglycemia, you want to think C, Addison's disease. With Addison's disease, they can present with that fatigue. They can have loss of appetite. They can have the weight loss. They can have the muscle and joint pain. They can have nausea and vomiting. They can have hypoglycemia, all of those things. Okay, so the best answer here is C, Addison's disease. Question number two states the nurse practitioner has Addison's disease as a differential diagnosis. What test should be completed to confirm this diagnosis? Is it A, a TSH, B, a ACTH, C, T3 and T4, or D, a plasma index? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question here states what test should be completed to confirm this diagnosis? So we're looking at Addison's as a differential diagnosis. What is one of the gold standard diagnostic exams to confirm a diagnosis of Addison's disease? And the best answer is B, your ACTH, okay? You want to do that for your gold standard. And then lastly, question number three, the nurse practitioner has confirmed the diagnosis of Addison's disease. What is the best treatment option? Is it A, Synthroid, B, glucophage, C, oral corticosteroids, or D, Elavil? Take a moment and tell me what you got in the comments, you guys. So, stem of the question here states, what is the best treatment option? And I tell you, if they're asking for a treatment, you need to run it back and look at the diagnosis. Look to see if they have provided you with the diagnosis so you can treat that. If they have not provided a diagnosis, you need to run it back a step further and look at the assessment findings so that you can determine a diagnosis because we have to know what it is to be able to treat it. So, here they have provided the diagnosis of Addison's disease. So your treatment option for Addison's, the best one is C, oral corticosteroids. And reason being, think about what Addison's disease is. This is when the hormone is having an insufficient, let's see the best way to explain it. You're having an insufficient amount of hormone release, like your aldosterone and your cortisol, right? So with Addison's disease, The adrenal gland, I guess is the better way I should explain to you guys, is what is insufficient, because due to the insufficiency or the deficiency of the adrenal gland, it can't adequately release the hormones of cortisol and aldosterone as you should. So I always say with Brittany's brilliance, because we have that deficiency and we're unable to release the hormones, the cortisol, the aldosterone as we need to, you need to add it back in. Add as in Addison's, add it back in. So we use hormone replacements like our oral corticosteroids to add it back in. I know I said a lot, but hopefully that makes sense. So again, you have the insufficiency with the adrenal gland, so it's unable to release the hormones to the level that we need, the hormones of cortisol, aldosterone, and this is what leads to your Addison's disease. So you need to add it back in to have the levels normalized. And what are we adding back in? We utilize oral corticosteroids to help aid in that hormone replacement. Okay, so C is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. If you need any of the resources that I offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 @gmail.com. Now, the things that I offer are my review book. The review book is designed for family. It's designed for family and adult gero, preparing for AANP as well as ANCC. Now, there is an ebook option as well as the paperback option. If you're looking for access to take on any with you on any device, like your Kindle, your phone, your tablet, looking at it on any of your electronic devices, the ebook is your best option. While the paperback option will be shipped to you from Amazon if that's what your preference is to have it. The beauty with the paperback option, there are interactive sections with each system breakdown where there's fill in the blank. So some people prefer that as they're able to write in the book to help. So if you're looking for any of those review book options, they're both linked in the bio of the channel. The self-paced review. So if you're looking for an independent review that you can study on the go, watching videos per system for family or adult gero, that is also linked in the bio of this channel. It's a self-paced review designed for both exams as well, with videos system by system with interactive sections and mini quizzes associated with each. The 5-week intensive review, the next one starts in September. The link is in the description. And then lastly are the one-on-one sessions. I always say reach out if you're looking to sign up with any of the one-on-one sessions, as they are customized. So you can either book a one-on-one session for a weakness that you need to cover, you can book an exam readiness assessment, or you can book the custom package where you are provided with a pretest initially. And based off of the timeline that you are looking to review, I structure a study plan on that time frame based off of your need spaces and work alongside with you to take you to a successful exam attempt. So if you need any of those resources, feel free to reach out to us at the nursing studio. But y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.